with the Shriners. So, Dr. Hafaday, we're very happy to have you here on the show and very happy to have you here on Guam.
Yeah, you're giving away your age because Shriners has been coming to Guam for 50 years, my friend.
Pretty close. I'm just about there, Doc.
And we have 100-year anniversary for the birth of our hospital on Oahu coming up next year. So we're making big plans for that. Guam has been a big part of what's made our hospital possible in Oahu.
Well, as you know, as the beneficiaries of of the very good work of your organization and everything like that, everybody knows and appreciates if there are people with specific cases in need of treatment or of diagnosis and everything like that, and even when the world was normal, pre-pandemic and everything like that, people would greatly look forward to the announcement that the Shriners were on the way and they would hold these clinics and everything. So if you can, Doctor, maybe contextualize it like a little bit, and since this is 50 years, kind of like break down for us how it started and where it's gone.
Yeah, so the Shriners Hospital, there's 22 hospitals across the world that treat children age 0 to 18 for orthopedic concerns. I think 100 years ago, the biggest orthopedic concern was polio. Wiped out polio, and then came cerebral palsy. And we've wiped out most of cerebral palsy, and now we treat kids with torn ACLs from sport injuries and fractures and scoliosis, kids born with club feet. So our mission has always been to provide excellent quality care to children with orthopedic concerns, and that's why we're here. We come twice a year to Guam. We stay for 2 weeks. Our home away from home now is the Guam Regional Medical City, but most people may remember us from Guam Public Health at Ongilao.
Now, if I can make a humble request on behalf of our community, Doc, is there any way that you guys could maybe diversify or expand your operations to include coronavirus? You guys did a great job with polio and everything. We could really use your help with COVID. If you guys can go ahead and eradicate that as well, we'd much appreciate that.
As we were getting ready to come here, we said, can you just stop the coronavirus for a week so we can get our job done? And and it looks like you're actually doing a pretty good job with that. One of the things is the vaccine is coming for ages 5 to 11, and that's Shriners Hospital in Hawaii is going to try to get involved with that vaccination program. Here in Guam, the Guam Public Health has been our biggest supporter. They help arrange our clinics. They help receive the phone calls for children who want help, and I'll give you those numbers in a minute. But I think they've got the battle against the pandemic well in hand. They're doing a great job here. You guys are leading the nation.
Well, our community has a lot, we share a lot of parallels with, the Aloha State and, in some of the challenges that we've gone through, the roadblocks that we've overcome, and even some of, the obstacles that lay ahead as far as, what going on now 2 years and everything like that. But, certainly with your help and, your input and everything like that, we feel really confident that we can get this thing done. But that being the case, Doc, when families and children go to you to avail of your services, seeing as how we're still in the pandemic, what are some of the new conditions and maybe operational changes that you've had to make with seeing youngsters?
Yeah, so we used to let the whole family come into the room so that when Dr. Pellet talks about their medical problem, let's say their scoliosis, uncle and grandma and grandpa could hear too. Now it's one parent only. So I encourage them to turn on their phone and take a picture. I show them the x-rays, and then they have to bring the message back to their family. That's pretty much the only thing. And then anybody who needs actual treatment, travel back to Honolulu for surgical treatment. We have to take more precautions, but we've mastered that long ago, the pre-operative testing and pre-procedure testing and the travel.
Absolutely.
That.
Yeah. So where is kind of the timeline? Let's kind of frame it like that. As far as when a young person is seen by your team when they visit here, and then either diagnosed or determined that they do need a more direct level of care, and then and treated and followed up on.
Yeah, so like I said, we're here twice a year and we see people in person. And then in between times, we do telehealth. So a family that has a new problem, let's say a baby that's born and they don't like the way the feet look, or a teenager who's developed knee pain, we can see them by telehealth. Sometimes if it's a bad problem, like somebody tore their ACL playing sports, we can figure that out by telehealth and start the arrangements to come travel to Hawaii and get it fixed right from there. But for a lot of slower problems, let's say scoliosis, we'll order the x-rays, make plans to get a brace, have the brace produced locally by our orthotist, our Shriners orthotist who's working here on Guam, Diana Lee. And then over time, if the problem develops to a surgical problem, we'll make the arrangements to come back to Hawaii for more advanced treatment.
Yeah, I wasn't aware that you guys were actually doing sports injuries, and I asked that question only because that's very, very interesting because it's still within the context of young people. But these are conditions obviously that happened, because of participating in some sort of activity. It kind of happened like now. I grew up always knowing the Shriners is if you had a condition that you either had like at birth or like it developed as you matured and everything like that, they'd absolutely be there to help you out. So as you've seen the pandemic kind of like go on and kids return to playing sports and everything, are you seeing a lot more sports injuries just because kids basically had to take like a year off of constant training and competition and they're getting hurt more often?
That's correct. And we've changed gears a little bit, and I don't think we'll ever go back. What happened was the other children's hospitals in Hawaii became inundated with pandemic, and our hospital, as a subspecialty hospital, was able to offload some of the injuries. So let's say when a child breaks their arm or hurts their knee, the last place they want to go is to an emergency room filled with people who are, that's overcrowded with people who are really sick. Mm-hmm. So we opened up our doors in Honolulu to almost a 24-hour-a-day, 7-day-a-week injury service. And that served its purpose. And now that we're emerging, we're about 3 months ahead of you guys in terms of our third wave. Our third wave has bottomed out now. And so the kids are all back playing sports. And yes, the sports injuries are there, the ankle sprains, the injured shoulders, the overuse. And that's sort of become we've always done it a little bit, but it's become our latest big business.
I would assume so. And, we've been covering that story as well as, when we were trying to tell kids, like when kids were allowed to return to active competition, we're like, okay, I know you guys are itching to get back on the field, back on the court, but, set your training regimen and don't go all, hardcore on that first day. There is a good chance, you may twist something, you may pull something, something may pop, perish the thought.
We've seen a fair amount of overuse injuries in the kids who were well-conditioned athletes, the 12-year-olds that were playing baseball 6 days a week 2 years ago. They took a year off and they go back just as hard. Like the day I tried to run the marathon in my 50s, and I was like, okay, my legs aren't the same as they were 10 years ago. So we've seen a fair amount of the overuse injuries there. And those are pretty simple. We just notch them back and then gradually build them back up again. Those ones are pretty easy to treat, but still, those child athletes need some guidance to avoid overuse injuries that could affect them in a nagging way for the rest of their sports career.
Certainly. And now that we've very appropriately kind of like defined the scope of your work and everything like that, the question that always comes up is, if I'm a local parent, how do I know if my child can qualify? And
you don't have to ask that question. We'll see any kid for almost anything. And if we can't provide help, I always know a little bit about it. I can give a little bit of advice or help steer them. If there's any questions that your child has an orthopedic concern that Shriners could help with, Guam Public Health has still been our main liaison here. And both Charisse and Nicole answer their phones and help patients get in touch with us. Their phone numbers are 671-797-2798 or 671. I think you have to dial the area code now, right?
We do. As of Sunday, we do.
727-0280. That's Sharice and Nicole, but they work for Guam Public Health. We all have an internet presence, so if you just type in Shriners, you can dig your way through the internet and eventually get in touch with us.
Okay, and as long as I've been doing these Shriner interviews and everything, I know, you know, your entire team, anyone I've ever interviewed, you know, that has an association with the Shriners group, never backs down from a challenge. And it says here, in April, the Shriners Honolulu Children's Orthopedic Clinic at GRMC saw 400 children, and you guys are actually looking to far surpass that number. You know, you're motivated, you're set, you've got the tools, you got the tech, and you know, let's go to work.
Yeah, yep, that's it. And then we're already planning the next visit, which ought to be around April or so. So even though we're here for another 7 days, I believe we're here for another 7 days. We're already planning our next trip.
Well, a lot of healing can certainly get done in that time, and a lot of anxieties calmed from family members, and you know, just a lot of good done in the community. And you know, we really thank you, Dr. Pellet, for your work and for the work of your team, because we are in awe of you guys.
I appreciate the publicity, because we don't want any child to go untouched if they have an opportunity and a need.
Absolutely. So once again, everybody, the number 2 call, and remember, as the good doctor said, you have to dial the 671 now. It's 671-797-2798, 671-797-2798, and that is for Sharice Santiago over at Public Health. The Shriners back on Guam, and they are doing very good work. Doctor, thank you so much for your time.
Thank you, Jason.
All right, have a wonderful stay on Guam.
All right.
Make sure to get some red rice. We'll make a barbecue plate for you and your team. You can count on that. All right, everybody, and you can count on the link having more really good information when we return from this commercial break.
We know you're tired of hearing about COVID-19. Some of you are probably wondering whether this is ever going to end. However long it takes, we all have to do our part, including our children, to hold the line. You can protect yourself and your family by getting vaccinated.
And if you're already vaccinated, don't let your guard down, because you can still give and get COVID-19. And if you're not vaccinated, remember